Well, good afternoon, everybody. I'm Dr. Bruce Katz. I'm director of the JUVA Skin and Laser Center. And today we're going to be talking about a revolutionary new treatment, a new approach to the treatment of cellulite. This has just been FDA approved about 2 weeks ago. And people are welcome to call our office, make an appointment to see if you're a candidate for the treatment once it becomes available, which hopefully will be quite soon. But at least come in, make the appointment, get on the list, because a lot of people obviously are interested already. And this way you reserve your place for this new injectable treatment for cellulite. It's actually called QWO. I'm not quite sure why they came up with this name. Apparently, it's supposed to stand for WO for women, and Q meaning that it is going to change the status quo for women. And the actual chemical itself, as you can see here on the slide, is collagenase Clostridium histolyticum. That's the actual name of the medication. So just to look at what the market is for cellulite treatments, we know that about 88 million women in the US are between the ages of 20 and 54, and about 80 to 90% of women have cellulite. So 80% of that number is about 70 million. And in a recent survey, they found that 37% of women with cellulite would have a minimally invasive procedure to get rid of it. So that actually amounts to 26 million women in the US who would like to have such a procedure. So that's a lot of women, obviously. And if you go online, you'll see a lot of searches for cellulite. And last check was about 15 million a year just for women looking for treatments for cellulite. And obviously, it's always all over the media, looking at celebrities who get out of a limousine and the paparazzi want to get a photo of their thigh to see if they have cellulite. So this is obviously a really popular issue. So what really is cellulite? Well, it's really a orange peel or mattress-like alteration of the skin surface. We see this sort of up and down, we call it hills and valley changes on the skin surface. As I said, it affects about 80% of women. And there are multiple theories of what causes cellulite. Some think it has to do with fat herniated up through the dermis of the skin, causing the raised areas. And other people think there's stiffening of the fibrous bands. And the fibrous bands are basically sort of collagen connections between the skin and the muscle layer, which goes through the fatty layer. And I'll show you some actual illustrations of this. But the fibrous septa getting stiffer actually pulls down on the skin and causes the dimples. So the fat herniated up actually causes the raised areas, and the fibrous septa pulling down on the skin causes the dimpling. And here you can see that in this diagram. This is the skin surface right over here. And this is the fat layer below it. And the fat, when it herniates up, obviously causes the hills or the raised areas of cellulite. And you see these fibrous bands that connect the skin to the muscle layer below. When that comes and pulls down and gets stiffer, that's what causes the dimples. And there are a lot of different scales when we do studies of cellulite to measure the changes in cellulite, from the dimples to the irregularities, as you can see here. And there are different types of cellulite. We see dimples as one type of cellulite, as I showed over here. As you can see, the discrete dimples in the skin over here and here. And then we see the undulating or rippling changes, which is another type of cellulite, as you can see here. So, a lot of people ask, why do women have cellulite and men don't? Well, if you look at the anatomy of the skin, in women, the fibrous bands, as I showed you earlier, that connect the skin to the underlying muscle, really are arranged vertically, and it causes these columns to develop. So the fat can, easily herniate it up because they're just columns of fat right next to each other. In men, the fibrous septa are arranged diagonally, as you can see here. So it's much more difficult for the fat to push up because you have these fibrous bands going across here, preventing fat from going up into the columns. You know, there are also hormonal changes that seem to affect cellulite. The reason for that is that we see that women typically develop cellulite often in puberty or during pregnancy or during menopause or premenstrual changes. Women on birth control pills sometimes can develop cellulite as well. And then there are also vascular changes. Sometimes blood vessels become engorged and lead to swelling of the fat cells that they surround. And certainly inflammation is one issue that we really believe has an effect causing cellulite, because that inflammation can cause the fibrous bands to get thickened and pull down on the skin, causing the dimpling of the skin. And here's an example. This is actually a colleague of mine, Dr. Hexel, doing an MRI of cellulite. But this is actually normal skin without cellulite. And here you see the engorged fat and the stretched fibrous bands in areas of cellulite. So, you know, how do we put this all together? What do we think is the most current theory of the etiology or the cause of cellulite? Well, we believe there are really three components. The fat herniating up, as I mentioned earlier, causing the hills or the raised areas. The fibrous septa pulling down here, as you can see, causing the dimpling. And then the looseness of the skin itself, of the dermis, that actually allows both of these things to happen. So I think we need all three components to occur, but in different areas, you'll see more of, say, dimpling and more of the undulations or irregularities of cellulite. Let's talk a little bit about treatments. There are a lot of non-invasive cellulite treatments out there, from bipolar and unipolar radiofrequency and infrared technologies, magnetic fields, low-level laser energy, and acoustic wave. And most recently, acoustic wave has really been shown to be the most effective of the non-invasive treatments. And then there are all the alternative therapies like mesotherapy, lipodissolve, carboxytherapy, endomology. These really don't do very much. And also topical agents like caffeine, aminophylline, retinols. Again, they don't really have any significant benefits for cellulite. The studies have shown that over the years, at most, they may have a temporary effect for a few hours, but nothing that's long lasting. But acoustic wave has recently got attention because it's non-invasive. And what it actually does, it creates these pressure waves that go through the surface of the skin and go down into the deeper tissues and affect the cellulite. As you can see here, it causes a shock wave that goes down into the fat layer itself. And if you look here, this is a study by Dr. Naranjo, where he used the Z-wave or shockwave technology to treat cellulite, and he did find some improvement. Here's an example of cellulite before on the left, and then after from his study. And then we did a pilot study at JUVA where we also used the Z-wave technology. And here you can see before and after, we found significant benefits of using it for cellulite. You can see here before and after. The problem is that you need multiple sessions, often 6 or 8 treatments with a Z-wave, and you have to do maintenance treatments because the results are not long lasting. Let's talk about some of the more effective treatments for cellulite. And we call these the minimally invasive, one of which was the first was subcision, which actually is just used for discrete dimples. I'll show you an example of that. It really doesn't work on the more diffuse type of cellulite. And then we have cellulase, which is a 1440 nanometer Nd:YAG laser. Selfino, which is a vacuum-assisted subcision, which is a form of subcision itself. And then most recently, QWO, which is collagenase Clostridium histolyticum, which is just the one I mentioned that was just FDA approved 2 weeks ago. So this is subcision, and basically we numb the area, we outline the areas of the dimpling, this is on someone's butt, and we use a special needle. It's called a no-core needle that has a blade on it, and it goes under the skin and breaks up the fibrous bands. Again, this, is a very basic treatment, and it works just for dimples alone. I haven't found it to be long-lasting myself. What I do find to be really had been the most effective until QWO came along is cellulase. And this is the cellulase laser itself, as you can see here. And what really allowed this device to become effective for cellulite is that for the first time, we can actually split a laser beam in two different directions. As you can see here, the laser goes out from the tip here in a typical fashion straight ahead. That's about 40% of the energy, but 60% of the energy actually goes sideways and actually allows us to change the direction of the laser beam under the skin. So I'll show you why that's important in just a moment. So here you see the laser, when it's under the skin, we can aim it down to melt the fat. So the areas where we have the fat herniated up, causing the hills, we melt the fat so it flattens the hills. Then we turn the laser beam sideways to cut the fibrous bands, so it releases these dimples, and that treats the valleys. And then we aim it up at the undersurface of the skin to stimulate collagen and tighten the dermis. That, takes away the skin laxity that firms up the skin so that the cellulite can't recur. So we published a study a while ago. This was a prospective IRB-approved study in one of the medical journals. It was a peer-reviewed journal using the cellulase technology. We did one treatment on 15 healthy women with cellulite. Basically, these are measurements which are not that important. And here what we did was we outlined the areas where you see the hills, the areas where you see the valleys, and then we tighten the skin in these other squares. And basically, we did evaluations with regular photos and then with three-dimensional imaging, which actually allows us to really objectively measure the changes. And we did patient and physician evaluations and skin biopsies to look at the microscopic changes. And here's what three-dimensional imaging allows us to do. You see the red area over here, this shows the deepest area of the skin surface. And this was obviously a dimple, which is the valley here. And the blue area shows the highest point on the skin surface, which is the hill. And after treatment, you can see the valley here has lifted because it's no longer red anymore and is less blue to show that the actual cellulite has improved. And we use these scales also to measure the changes in the dimples. We measure the changes also in the irregularities or the undulations of cellulite. What do we actually find? Well, we found that certainly in terms of the dimples, we found statistically significant improvement in the dimples. As you can see here, this is the dimples before and then after. You can see it's completely raised up. And the hills have gone down because the blue has gone away for the most part. And the contour irregularities, we saw a 66% improvement at 6 months. So we found that the cellulase treatment really had statistically significant benefits for cellulase, as you can see here in another three-dimensional imaging photo. I'll show you some before and after clinical images. Oh, by the way, when we did the microscopic biopsies, we found more collagen and elastic fibers in the dermis, which confirmed that we were actually tightening the dermis with the laser as well. So here are some examples of the cellulite before and then after with significant improvement with cellulase treatment. And another example before on the left and after on the right, also significant improvement in the cellulite. And here another example as well. So in conclusion, we found that the cellulase laser, the Nd:YAG 1440 nanometer laser, produced significant improvement in cellulite with only one treatment after 6 months of follow-up. And we actually follow these patients for years after. I've just seen actually a patient who came in at 7 years after we did her first treatment. She was so happy with the results on her anterior and sides of her thighs. She wanted to do her butt and the back of her thighs. There are really no serious side effects at all. The worst side effects from cellulase, you get some bruising and swelling for a week or so. So we really found this to be a significant advance in the treatment of cellulite. And the only downtime is people have to wear a garment, sort of like Spanx, for a week, and they can't exercise for a week. But then, basically there's really no downtime per se. Okay, well, let's talk about the latest and greatest new treatment, QWO, for the treatment of cellulite. So how does this actually work? Well, QWO is basically an enzyme that targets and releases the collagen fibrous bands under the skin that causes the dimpling. It's actually been available for quite a few years as a medicine called Xiaflex, which treats these conditions: depredens contracture and Peyronie's disease, which are basically problems with fibrous bands in the skin. And we just completed the phase 3 trials. I was one of the investigators for this study to basically evaluate how well this worked. And as I mentioned earlier, you guys can come in and make an appointment to get on the list for this treatment. And I'll explain why in just a moment. So basically, the goal with this treatment is to release the fibrous bands that are pulling on the skin, causing the dimpling, so we end up with smoother skin. And like I mentioned, this was just FDA approved about 2 weeks ago. So this is just a little video showing you how it works.
On the surface of the skin. It affects up to 90% of women of all ages, sizes, and races. Cellulite starts under the skin with a pattern of fibrous bands that connect the skin to the muscle. Over time, some of these fibrous bands thicken, creating tension that pushes fat up. This causes the surface dimples, commonly referred to as cellulite. Collagenase Clostridium histolyticum AAES, or Qwo, is the first and only FDA-approved injectable for moderate to severe cellulite in the buttocks of adult women. Qwo is a mixture of two naturally occurring collagenase enzymes, OX1 and OX2. These enzymes target type 1 and type 3 collagen found in fibrous bands and work together to break down the buildup of collagen causing cellulite. Injected, Qwo only expands to the size of the finger and is not absorbed into the bloodstream. When Qwo is injected, the fibrous bands are broken. It is thought this may release the dimple and smooth the surface of the skin. What is Qwo? Qwo is a prescription medicine used to treat moderate to severe cellulite in the buttocks of adult women.
So that's basically the sort of animation explaining how it works. Let me tell you a little bit about the science. So we did this study. It was actually 2 major studies in multiple centers, and we injected the active medicine, the QWO, in one buttock, and we had a placebo in the other buttocks. This was really a placebo-controlled, blinded study. We didn't know which was which. And we treated women from the ages of 18 to 78, large ranges of BMI, all skin types, and basically did 3 treatments, once every 3 weeks, 3 times. And initially in this study, in the buttock area, we did this injection technique. We injected in each dimple 3 different directions, as you can see here. There were 843 women in the study. So this is actually the largest study ever done for cellulite. That was really, obviously very important. You can see here, all skin types and races were included, all Fitzpatrick skin types. This is the scale we use to measure the improvement in cellulite from the treatment. What do we actually find? Well, the primary endpoint was a 2-level improvement on that scale I just showed you in the treatment of cellulite. And we found a statistically significant improvement in the buttock treated with a QWO versus the placebo. We also found a statistically significant 1-level composite improvement with the active medicine, the QWO, compared to placebo as well. Here's an example of the buttock treated before and after. You can see the dramatic improvement. And also another example here, before and after as well. And even in clothing, it's interesting, you can see that the cellulite is obviously improved uh, in clothing that you can see here in a woman wearing tights. When we ask patients for a global, aesthetic improvement evaluation, again, statistically significant improvement with the QWO side compared to placebo, and the patients were all satisfied as well and statistically significantly improved and satisfied. In terms of side effects, what we did find is that most women develop some bruising from the treatment. Usually lasts a few days to a week or so, depends on the person, but no serious side effects really. And here you can just see some other before and after photos of the QWO treatments. Here's a 3D image as well. And you can see the really dramatic improvement with this treatment. So, as I mentioned earlier, we know that cellulite is different in the buttock compared to other areas, such as the thighs. And because of these anatomic differences, we wanted to see if different injection techniques work better, say, in the buttock cellulite compared to the thigh cellulite. So we did 5 different injection techniques. This is what you can see here. In this technique, we did the typical one we did in the first study, the 3 different directions in the dimple. Here we just did 1 shallow injection. This is another technique. Here we did just one deep injection. Here we did both shallow and deep injections in 5 different areas of the dimple. And here, just shallow injections in 4 different areas of the dimple. What did we actually find? Well, we did this study in 63 women, and we found that the first technique, technique A, which is just 3 injections in the dimple, really had the largest statistically significant improvement in buttocks type cellulite. For women with cellulite in the thighs, we found that technique D, I'll go back and show you, this one here, where we did deep and shallow injections in 5 different directions of the dimple, worked best. So you really need to do different injection techniques in the buttock versus the thigh to get the best results. And again, moderate safety profile, just side effects being some bruising from the treatment. So in summary, optimal treatment outcomes occur when we're using the specific injection technique that works best for the buttock versus the thigh. And this is consistent with the changes in the anatomy as well. So to conclude from we just showed you in this presentation, QWO or CCH significantly improves cellulite severity and the appearance in women with moderate to severe cellulite on the buttocks and thighs, both by clinician and patient-reported outcome measures. It was well tolerated. And now what we're doing to see that this treatment actually is long-lasting is we're doing a 5-year study to see how durable the treatment is after treatment with QWO. So thank you very much for your attention, and I'll just open it up to any questions. Just before we do go into questions, I just want to remind everyone, call to make an appointment if you're interested. We can do a consultation with you to see if you're a candidate for QWO. When it comes out, then you'll be high up on the list, and you'll be able to get the treatment a lot sooner than if you wait and then come in later. So thank you very much for your attention, and any questions?
Hi, Dr. Katz.
Yes.
I was wondering about cellulite on the arms, both outer and inner.
Well, that's a good question. We haven't evaluated it yet, but I can tell you the cellulite we see on the arms is typically like cellulite on the thighs. So we will use the technique D, where we do shallow and deep injections to treat it, and it should do very well.
Okay, thank you.
You're welcome.
Dr. Katz, how much does a procedure like this cost?
That is the $1,000,000 question. Unfortunately, we don't know yet because the company hasn't come out with the pricing. But I told them when we had a meeting in February that this has to be priced moderately. It can't be expensive because so many women have cellulite. Like I said, 80 to 90% of women have cellulite. We want this to have wide access. We want, all kinds of women and all economic groups to be, this to be accessible to them. So I hope, I really try to, give them the message that this should be fairly priced and not ridiculously expensive. And, that has happened, unfortunately, in other treatments. Kybella, you may be familiar with, which is a fat melting chemical that was priced way too high and as a result was not popular, and the company didn't do well with it. And Selfina also was priced way too high and has not been very popular. So I hope they will come out and be reasonably priced.
And then one more question to add to that. What would
Sure.
be the benefits of getting this over, say, getting like Sculptra, like injected, or some kind of filler that you guys do that you inject into the cellulite dimples?
Well, Sculpture really doesn't work that well for cellulite. It works well for loss of volume. We use it as the Brazilian butt lift. We use it for volume restoration on the face, for crepey changes on the arms, but it's really not a treatment for cellulite. I know some doctors use it for that, but I just have not been impressed with the results, and obviously it hasn't been promoted by the company for treating cellulite because this doesn't work very well.
Okay, thank you.
Mm-hmm. Any other questions? Well, thank you all for joining us today. Again, if you have any questions, call the office, set up an appointment about whether you're a good candidate. We'll get you on the list so you can be one of the first to try it out when it becomes available. Otherwise, have a great weekend. And just to let you know, we have some specials. Check out our website, www.juvaskin.com. The latest specials with Mommy Makeover you'll be hearing about. We have great discounts for procedures, other really interesting technologies that we've just come out with recently. All the best. Take care now.
Thank you.
You're welcome.